At UCSF, we deliver some of the best spine care in the world, and I want every fellow who trains here to leave here and say the same thing about their own practice. Hello, I'm Dr. Rajiv Sethi. I'm the Spine Fellowship Director here in the UCSF Department of Orthopedic Surgery. I'm also the Division Chief of Spine in the Department of Orthopedic Surgery, and also serve as UCSF System Medical Director for musculoskeletal value-based healthcare initiatives. I personally did my spine fellowship here at the UCSF Spine Center 20 years ago, so it's an honor to return here to UCSF to help equip the next generation of spine surgeons.
The Spine Fellowship at UCSF is a very old fellowship. It started back in 1990 with our first spine chairman, who was David Bradford, and he established the UCSF Spine Fellowship. And over the course of the last almost 3 decades, our program has flourished.
UCSF Spine Fellowship is a comprehensive one, including a non-operative and an operative arm, full-time spine surgeons, and a tight collaboration with neurosurgery and neuroradiology. Trainees here will work across a full technical spectrum that includes minimally invasive procedures, open procedures from occiput to sacrum, and they will work with both orthopedic and neurosurgical spine surgeons. This includes significant exposure to spinal deformities, degenerative conditions, and complex reconstructive conditions of the spine, including the treatment of primary and metastatic spine tumors, all together with a strong educational program with teaching and research conferences held 3 days a week. Trainees have the opportunity to direct their own education by perusing cases and clinical practices that match their own interests.
Every day of the week, there are surgeries, operations that the fellows can participate in. Also, the same holds true for the clinic. And so fellows have an opportunity to somewhat choose their own schedule based on their interests, but also based on what experiences they would like more training in. And fellows can be in the operating room 5 days a week if they like. They can be in the clinic 5 days a week if they like. But we found that splitting it up into 3, maybe 4 days of OR per week with 1 to 2 days of clinic is ideal.
I really enjoyed the ability to control my schedule and to choose my experience in fellowship. I think the ability to choose your own adventure is an excellent strength of the program.
Another great benefit of working at UCSF is that you're not only working with great spine surgeons, you're also working with world-class anesthesiologists, you're working with world-class ICU physicians, you're working with world-class pain management physicians.
With the combination of the variety of cases and the variety of surgeons with whom you work, you're exposed to a variety of different approaches. We do anterior surgery, lateral surgery, posterior surgery, non-instrumented cases, instrumented cases, freehand navigated technique, minimally invasive techniques. And so what that means is when you graduate, it makes you the most versatile surgeon possible.
One of the nice things about UCSF is that with the degree of complexity, there was still an appropriate graduated autonomy in the operating room, where in the beginning, of course, you're assisting and doing some more observation, but as the year progressed and your skills progressed, you're doing much more of those cases in conjunction with your attending, which is a really wonderful way to learn.
My fellowship experience, was excellent. I got to learn from my mentors, the guys who write the papers. And I think the relationships that I've made with my co-fellows, residents, and the attendings have just carried over. So I can still rely on any of the UCSF attendings as mentors throughout my career.
Our fellows come to the courses that we do. We do a course in San Francisco, in Hawaii, and in Las Vegas each year. And we have a number of fellows who come back, they share their experience and their cases, and then they stay in contact throughout the year and bounce ideas off of us, and we bounce ideas off of them, and we all learn from each other.
Me and my co-fellows are texting every few days, and we talk about our cases and see how we're all evolving our practices. I also text the attendings every few days as well, let them know about the cases I'm doing and running things by them. And I can honestly say, I'm privileged to have them as lifelong mentors and even friends.
San Francisco is a city for anybody. It's a small city. It's only 7 miles by 7 miles, but there are so many little micro environments in it that no matter who you are, you can find something that suits you.
With incredible food, surfing, skiing, wine country that are all within reach.
We have had no fellow tell us that they've struggled once they've left. They go everywhere. We've had fellows go into private practice, fellows who go into hospital-based systems, and also academics. Every fellow, when they leave, is scared. They don't know what's going to happen, but ultimately, based on the skills that they've learned and all the techniques that they've participated in and observed, they are more than ready to take care of patients.
My future vision is really to create leaders in spine surgery and are ready to lead the next chapter of this field. I want to have people come here who become leaders in spine care, people who challenge us with what we need to do better, people who lead our field, people who make the name of this institution, this fellowship, shine even further. Those are the people that we want here with us. We also want people who leave here to be able to handle anything. This is not just a spine deformity fellowship. Although we are leaders in the care of spine deformity, we do a lot of other areas of spine just as well. That includes minimally invasive surgery. That includes pediatric spine surgery. That includes the care of the spinal trauma patient. So we are not just a spine deformity fellowship. So I thank you for your interest in our program, and we look forward to speaking with you in person.